Well, good afternoon, everyone. Thank you very much for your patience. We apologize. It took us a few minutes to get started here. This is obviously a very popular webinar. We have over 5,000 participants currently online, and the number is climbing as we speak. So certainly an indication of how important this is. This is Jim Birch. I'm the president of the National Police Foundation, and I am very pleased and honored to be joined on this webinar here today by Laura Cooper, the Executive Director for the Major Cities Chiefs Association, and Chuck Wexler, the Executive Director for the Police Executive Research Forum. Together, our three organizations were absolutely honored that the CDC was willing to assist us in conducting this briefing today for law enforcement around the country, and we hope that it's beneficial for all of you going forward. With that, I'm going to turn it over to Chuck Wexler, who's going to facilitate today's session. Again, thank you all for being with us. Chuck?
And thank you, Jim, for this bringing us together. I think this is an important opportunity. The country is facing unprecedented challenges. So we're going to divide today's session into two parts. The first part will be a public health perspective, and the second part will be a law enforcement perspective. Each will be about a half an hour. I, again, apologize for the getting started a little late, but we will stay on the line for an hour. So this is a public health issue we're facing, but this is also a law enforcement issue, but public health clearly has the lead. I want to introduce the folks from CDC. Dr. Marie DePerio is a medical officer and physician board certified in internal medicine, infectious diseases, and she's at CDC's National Institute of Occupational Safety and Health. She's worked on CDC's past responses to infectious diseases, outbreaks, including the pandemic, H1N1, influenza, Ebola, and she's currently assigned to NIOSH as Deputy Director for Program and working full-time on this issue. She will be joined by Dr. Kyle Muller. He's the Environmental Health Officer. He's an occupational epidemiologist at the National Institute for Occupational Safety and a Lieutenant United States Public Service. These two individuals are going to spend some time talking about this really from their perspective, but also keeping in mind the importance to law enforcement. So, Dr. DePerio,
the
floor is yours.
Thank you. So thank you, everyone. Chuck, can you hear me okay?
I can hear you loud and clear.
Great. So thanks, everyone, for this opportunity to present to you today. So we understand that we're in a time of significant uncertainty, and we all have tremendous respect for the critical work that you all are doing to keep this country safe. We're going to do our best to give you useful information and then answer your questions based on what we know today. We do learn new things about this virus and the situation every day. So what we tell you today might actually be outdated in a few days. So with that being said, here's an overview of what we're going to cover. First, I'm going to cover some background on coronavirus disease 2019, shortened to COVID-19, including basics about transmission, symptoms and disease, and then also epidemiology. And then I'm going to talk about where we are with COVID-19 in the United States. Then I'm going to turn it over to Kyle Muller, and he's going to talk about preventive measures for law enforcement on the job. And then I'm going to close with talking about some preventive measures for law enforcement at home. So COVID-19 is the shortened version of coronavirus 2019, and you can see here how the acronym is formed. So as you all probably know, COVID-19 was first identified in Wuhan, China. So the disease is caused by the virus, which is now referred to as SARS-CoV-2. So early on, many of the first patients were reported to have a link to a large seafood and animal market in China, but now we're seeing widespread person-to-person spread. The first imported cases in travelers, and then community spread throughout this country. So our first US case was identified on January 21st. CDC is reporting confirmed COVID-19 cases in the US online at the link below, and it's being updated every day. Investigations are ongoing to better understand the spread or transmission of this virus. What we know about transmission is largely based on what we know about other coronaviruses. So the virus is spread person to person and most commonly between people in close contact with each other or about 6 feet. We believe it is primarily spread through respiratory droplets produced when an infected person coughs or sneezes. We also think there is possible spread from contact with infected surfaces or objects and then touching the mouth, nose, or eyes, but we don't yet know what the relative contribution of contact transmission is. COVID-19 can cause a wide range of illness severity from mild to severe illness to death. So the most common symptoms that we are seeing are fever, cough, and shortness of breath. Preliminary data reported shows about 80% of cases have a mild illness. About 20% have more severe illness and then need to be hospitalized. The estimated incubation period, which is the time from exposure to the time of showing symptoms, is about 2 to 14 days, with the average being about 5 days. Complications of this disease can include pneumonia and respiratory failure, and we are seeing that this is more common in older patients and then other patients that have underlying medical conditions. So the virus that causes COVID-19 is a novel virus, meaning that no one has any underlying immunity to the disease. We currently don't have a vaccine, and we don't have a specific licensed antiviral treatment for it at the moment. Supportive care has been the main strategy, and this focuses on relieving symptoms and managing pneumonia and respiratory failure. So now I wanted to talk to you about COVID-19 in the United States. So this is a map of COVID-19 cases in the United States. So as of yesterday, so March 18th, all 50 states have reported cases, as well as DC and some of the territories. So the darker color means that these states have higher number of cases. So as of yesterday, New York had the highest number of cases, followed by Washington State and California. So this is an epidemic curve of COVID-19 cases in the United States. So the vertical axis shows the number of cases, and the horizontal axis shows the date of symptom onset. So note that we're still waiting for test results for those with illness onset over the last few days, so the numbers are expected to be much higher. So as of yesterday, March 18th, we have 7,038 total cases in this country and 97 total deaths. Not included in the total are the 49 cases among repatriated US citizens from cruise ships in Wuhan, China. So now I'm going to turn it over to my colleague Kyle Moeller, who's going to discuss some preventive measures for law enforcement on the job. So in general, CDC tries to give guiding principles to occupational groups about prevention and control measures that they can take in their workplaces. We try not to be super prescriptive, knowing that workplaces, even within law enforcement, can be different in regards to size, staffing, and job activities, among other things. So we believe jurisdictions should take these guiding principles and see how they can be applied to their situation. So I'm going to turn it over to Kyle and go on mute.
All right, thank you, Marie, for all that great background information. We will now be discussing the preventive measures that law enforcement can take while they are on the job. The CDC recently released a one-page fact sheet entitled, "What Law Enforcement Personnel Need to Know About Coronavirus Disease 2019, COVID-19." This document was intended to be concise, easy to understand, and easy to print and distribute. It provides background information on the illness, how to protect yourself from exposure, recommended personal protective equipment or PPE. Sorry, excuse me, my throat's hurting. How to clean if close contact occurred during apprehension, and ultimately directs you to the CDC website for more information if needed. Next slide, thanks. Now we will provide a brief overview of what law enforcement leaders and personnel can do. First, we will begin with law enforcement leadership. If this hasn't been done already, leadership should create a response plan for COVID-19. This plan should have strategies to protect their workforce while ensuring continuity of operations. Further guidance on developing a response plan can be found in the CDC's interim guidance for business and employers. Next, leadership should be engaging their state and local health departments for the most up-to-date information on local outbreaks. Leadership should develop or refine their processes to communicate important information to employees. Leadership should implement flexible, non-punitive sick leave policies so that employees do not feel pressured to come into work while feeling sick. and leadership should familiarize themselves with CDC's risk assessment guidance for contacts of lab-confirmed cases. This guidance is regularly updated as needed and as additional information becomes available. The most recent update was on March 14th to include a section on personnel in critical infrastructure positions, such as first responders, and provides information on circumstances in which personnel may continue to work following an exposure. Next slide. Additional steps that law enforcement leaders can take are adjusting or postponing large meetings, gatherings, and trainings. One way to adjust these meetings is to use video conferencing when possible to practice social distancing. Leadership should train personnel on prevention measures, including hand hygiene and the appropriate use of PPE. Leadership can prioritize calls for service and consider remote reporting for lower priority calls, such as minor traffic incidents. Leadership can also implement telework for non-essential personnel when feasible. This could be for administrative or potentially investigative personnel. Next slide. Now we will discuss what law enforcement personnel can do. First, personnel should learn about their employer's plan for COVID-19 to be aware of the acting policies and procedures. Next, personnel should stay home if they are feeling sick with symptoms such as fever, shortness of breath, and cough. If possible, personnel should maintain a distance of at least 6 feet from others. From personal experience, I know this next one is a hard habit to break, but we should all stop shaking hands for the time being. Some popular alternative ways to greet one another that I have seen are the elbow bump and an enthusiastic greeting with a wave. This next one has always been important, but now is a great time to remind everyone that we should all wash our hands regularly with soap and water for at least 20 seconds, especially after coming into contact with people or objects. If soap and water are not available and illicit drugs are not suspected to be present, personnel can use an alcohol-based hand sanitizer that contains at least 60% alcohol. This is important. Do not use hand sanitizer if illicit drugs are present, as the hand sanitizer may enhance the absorption of the illicit drug. Finally, personnel should avoid touching their face, and if they must, only touch their face after washing their hands. Next slide. So what should law enforcement personnel do if they think they have, that someone may have COVID-19? First, personnel should have trained EMS or EMT assess and transport the individual to the healthcare facility. They should ensure that only trained personnel wearing the appropriate PPE have contact with that individual. If personnel must have contact with someone with confirmed or suspected COVID-19, personnel should first place a face mask on the person with confirmed or suspected COVID-19 for source control. Personnel should follow CDC's interim guidance for EMS. This guidance applies to all first responders who anticipate close contact with persons with confirmed or possible COVID-19 in the course of their work. It recommends that municipalities determine the need for 911 public service answering points or PSAPs and emergency call centers to use modified caller queries. Use of modified caller queries will allow dispatchers to communicate immediately to first responders that the call they are responding on may involve a person with confirmed or possible COVID-19 and allow the first responders to don appropriate PPE before their arrival on scene. Finally, use the recommended PPE. These are gloves, isolation gowns or coveralls, a fit-tested N95 respirator or a face mask if a N95 respirator is not available, and eye protection. If there was close contact during an apprehension, follow these steps. Clean and disinfect the duty belt and gear prior to reuse using a household cleaning spray or wipe, according to the product label. The CDC does not recommend specific brands or products, but approved cleaners can be found using the EPA's List N of disinfectants for use against SARS-CoV-2. After doffing PPE, follow standard operating procedures for the containment and disposal of used PPE, and follow standard operating procedures for containing and laundering clothes while taking extra care to avoid shaking the clothes when handling them. Now I will hand it back to Marie to discuss prevention measures that law enforcement can practice at home, and I will go on mute.
Thanks, Kyle. So we just wanted to end the presentation with just a couple of slides on prevention measures for everyone to take at home. We know that there's a lot of concern about our household members. So here are some everyday actions for respiratory illnesses that everyone should be aware of. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue and then throw the tissue away. It's important to clean and disinfect frequently touched objects and surfaces like doorknobs and railings and things like that. And then instructing everyone in the house to wash their hands with soap and water for at least 20 seconds is also really important. Here are some tips on how to get your household ready for COVID-19. These are all things that we have done in my household. I have a pediatrician as a husband, so we are working our way through this list. So first off, identify a room to separate sick household members. Create an emergency contact list. So this is a list of people that you can call when you have to go to work, but your kids are home from school and no one can stay home with them. Plan ways to care for those at greater risk for complications. So if anyone has, anyone in their household who might have chronic medical conditions or are older, definitely plan for ways to take care of them if they get sick. Limit close contact with others as much as possible. And around the country, we are hearing that schools are closing, bars, restaurants, workplaces. The social distancing is becoming a more widespread strategy at this point. It's important to, as I said before, clean and disinfect frequently touched objects and surfaces. And then it's also important to avoid sharing personal items. So that's all we wanted to cover right now. These are some web resources that we thought might be helpful to you in law enforcement. And I know that we want to have an opportunity to take a lot of the questions and answers that have come through over the last few days. So I will turn it over to Chuck to start going through that list.
Okay, doctors, that was an excellent presentation. I was on a conference call yesterday, and the number one question that first responders are asking is if they feel that they may have the symptoms, is there any plans for having first responders tested at a higher priority?
So we have heard this question from our healthcare stakeholders and our EMS and firefighter stakeholders. We have taken that question back to CDC response leadership to take a closer look at it and see what strategies for lab testing we can come up with.
Okay, because that is clearly an issue for police departments when you have individual police officers or firefighters or dispatchers who may come in contact with someone. Right now, the best they're doing is quarantining them for 14 days. Does that make sense?
Yeah, so actually CDC has come out with some guidance for discontinuation of home isolation. And there's, knowing that there is not widespread testing available at this moment, there's strategies to take for return to work of people that are infected. There's a non-test based strategy. So if the person wasn't tested but does have symptoms consistent with COVID-19, then at least they should be at least 3 days out since recovery. So recovery means the fever is gone and the respiratory symptoms, so like cough and shortness of breath, are gone. And at least 7 days have passed since symptoms first appeared. So we're finding more data that suggests that people don't need to be at home for the full 14 days. Now, if someone has been tested and they have symptoms, then it would be resolution of the fever, improvement in the symptoms, and then 2 negative results of testing, nasopharyngeal testing. So if someone's been tested, so the third strategy, if someone's been tested and confirmed, but they don't have symptoms, they should stay home for 7 days since the date of their first positive test, and as long as they don't develop illness.
One related question to that is, how about the co-workers to that person? You have that person who might have symptoms, and then, if they have a partner, for example, in a car or an ambulance or something. What do you think about the partner who sits close to them? Is there anything that should be done in that case?
Yeah, so CDC also has guidance for, we call it the risk assessment and management of contact with lab confirmed cases. I think we have the link somewhere on the presentation, but people get classified into high, medium, and low exposure risk. So like partners of, if a law enforcement officer develops the disease, they're symptomatic, they've exposed their partner, that partner would most likely go into the medium exposure risk, which is defined as close contact, so within 6 feet of a symptomatic lab confirmed case. So the guidance for that is that that officer remain at home and practice social distancing for 14 days. I will say that this guidance was updated, as Kyle mentioned, a couple days ago, and it now has a section for personnel in critical infrastructure positions. So this includes first responders like law enforcement. So there is a section that says personnel that have been exposed but are not symptomatic could continue working after an exposure, provided that they remain asymptomatic. They should, yeah.
Yeah. And that's why this testing is so important, isn't it? Because if you had the testing, that would really cut down the days from, say, 14 or 7 to like 2 or 3. Is that right?
Yeah, so if the testing's negative and an alternate diagnosis is made, such as the flu or strep throat or whatever, return to work could happen sooner.
So that's why it makes it such a priority. Okay, that was great. Let me ask you this. Do you have any information as to whether the federal government will be providing personal protection equipment to law enforcement around the country, and if so, when?
So I will say that the federal government operates the Strategic National Stockpile. CDC does not operate it. It's operated by the Office of the Assistant Secretary of Preparedness and Response, otherwise known as ASPR. So the stockpile has PPE such as N95 respirators, face masks, gloves, and gowns, among other things. So CDC has been informed that ASPR has released a first allocation to the states, and that's proportionate to their population. So if you're in a state that has a larger population, you get more. We have heard it's releasing a second allocation to states that are seeing widespread transmission. I know that Washington State received a second allocation. So once that product is released to the state, it belongs to the state, and then the state determines how then to allocate their equipment to users. So our recommendation is if law enforcement leaders haven't already, they should contact their local and state public health departments and their emergency preparedness partners to try and get an allocation of that for their personnel. We're hearing the same concerns about PPE shortages from our stakeholders in both healthcare and EMS. So this is a big issue. I did want to note that CDC, we have developed strategies for how to conserve your supply of PPE, including N95s, gowns, eye protection, and face masks. And we can add that link to the presentation.
So here's where your recommendations and reality collide. So police officers, by the very nature of what they do, they very often have to come in contact with people, and they can't maintain that 6 feet. And they could be called to locations, and they may not even know someone has the symptoms, and yet suddenly, they have to put their hands on them for some reason, and then they recognize quickly that they have all of the symptoms. Obviously, that's a real challenge. I know there's not a great answer, but from your perspective, how should first responders think about those situations after they have encountered someone that they think by visually looking at them has the symptoms?
Yeah, so, we're trying to head it off by recommending, the steps Kyle mentioned during the 911 and other PSAP call process, so that we're trying to reduce the number of law enforcement officers and other first responders that are walking in blindly to a situation. We're hoping that with some advance notice, and if you don't get advanced notice and you do suspect that someone might have COVID-19 or symptoms that are consistent with that, put the PPE on and protect yourself. I know this is difficult in law enforcement because your first job, or one of your main jobs, is to secure the scene and make sure everyone is safe. But we also want to make sure that, law enforcement officers are keeping safe too.
So I think we're coming up, these are great responses. At what point during incubation would tests detect this virus?
So we're still trying to figure that out right now. We are testing people. We are seeing positive tests for people that don't have symptoms. We think that for the people that do develop symptoms, it's usually a couple days after they develop symptoms that the tests are positive, but we're still waiting for a lot of data to come in on that.
Okay, listen, I know you've been terrific, both of you. You're going to stay on the line. We're going to switch gears now with the two police chiefs. Thank you very much. Chief Sherry Harris, can you hear me, Chief?
Good morning.
How are you?
I'm doing well, thank you. I say good morning because it's only 10:30 here near Seattle, Washington, and Kirkland.
All right, let me introduce Chief Sherry Harris. She's the Chief of Police of Kirkland Police Department, 157 personnel, commissioned, and with a corrections facility of 62. She was promoted to Chief of Police in April 2016. And she has had 27 years of law enforcement experience. In many ways, the Kirkland Police Department is symbolic of many police departments in the country. It's kind of a medium-sized department. There's 18,000 police departments in the country. So when something like what you faced hits you, a lot of police folks look at your department and your leadership and really can learn from it. Tell me, Chief, at what point did you recognize you might have a real problem on your hands?
Well, I'll tell you that we're, Kirkland, just for a little perspective, we're a neighboring agency to Seattle. And just a couple details, we only have 107 commissioned of total 158 civilians. And on February 28th, the city of Kirkland learned that a nursing home specializing in both short-term and long-term care with both inpatient and outpatient rehabilitation had the first COVID-19 death. We also have a hospital in our city, and that death had occurred at the hospital. In addition, we learned that day that the first healthcare worker had tested positive. That led to us quarantining 17 firefighters. And through some very exhaustive investigations on calls for service that were associated with the nursing home, we ended up ultimately having 31 firefighters in quarantine, 4 police officers. And then on March 8th, the first positive COVID-19 test was received for a Kirkland firefighter. We learned that the staff at that nursing home moves between multiple facilities in neighboring jurisdictions. So they work at multiple facilities, and we started seeing positive cases there. Just for some perspective, we're in King County. There are 562 positive cases in King County. There are 65 deaths in King County, and there are 35 of those deaths that are associated with this nursing home. So we, within a few days, knew that we had a big problem. We had multiple calls a day at the nursing home. It's called Life Care Center. Both the Kirkland Fire Department and private ambulances were transporting out of the facility. We had death investigations. Within a couple days, the medical examiner had decided not to respond to the deaths, and they became natural deaths, even at times when there had been CPR performed. So we immediately started providing our officers with personal protective gear and opened up an emergency operations center with a unified command with both the police chief and the fire chief working cooperatively together. We're taking advice from the fire department health officer and the King County, their King County medical program director that provides direction to EMS. They're very well connected with the public health here. They have been incredibly supportive and helped us in determining what kind of personal protection to wear and when to wear it, and then reviewing calls after we have been involved in a death investigation or some kind of medical event that fire needed support. to determine whether we needed to quarantine officers or whether their protective gear was appropriate and they had not been exposed.
Chief, let me stop you there for a second and just ask you this. So, two perspectives. One, you know, you're the first place in the country that this really hit hard, and we've been told that this virus will spread and will increase significantly. If you were addressing the police chiefs of the country, and you are, there's 5,000 people on here, what would you tell every police chief? How would you get them to think about how to prepare for the kind of thing that you faced?
Well, obviously in educating police officers on the appropriate personal protection to use. We did not know that N95s in our state needed to be fit tested. I would also say that you have to have, or it is beneficial to have a very close relationship with the fire department and be in daily communication with the health officer, because they're getting direction from public health as well. And they're getting direction, of course, obviously from the CDC. And they're better connected with the hospitals and the medical personnel in those hospitals that are seeing the virus and the cases and who's surviving and who's not, to give direction back to law enforcement. We don't, in our state, law enforcement does not have medical advice to turn to.
Have you made significant changes since this incident? What changes have you made, and how are they working out for you?
So we know, all officers are carrying protective eye gear on their person and N95s in their pocket and gloves. Like they've always had gloves, right? We're asking them not to rush into death investigations, to send, and we use this term on the fire side as well, a scout in to determine what kind of, assistance is needed for the investigation. We're calling people and asking them to come outside and going into homes, at a last resort. So far, everyone is very cooperative with that, very collaborative. And we've had to start prioritizing what calls we're also going to respond to.
Let me ask you this. So the pandemic hit you hard, and just correct me if I'm wrong, it feels like it hit you hard, but since that initial outbreak, have the numbers of people infected continued to go up? Has the number of people who have died continued to go up? Or was there a period where it was hit hard and things have kind of stabilized now?
The 35 deaths that have occurred in Kirkland, 5 of those were in the last 24 hours. So I would say that it continues to increase. However, the facility in our city has been stabilized. And the way that occurred is that there was a lot of political pressure. There was, and I can only tell you from my perspective on how this occurred, but cooperating with public health, there was a lot of pressure that was put on the CDC to get more support for this nursing home. There were times at night where they did not have enough staff to actually cover the entire facility, and they ended up actually sending in a disaster medical assistance team, an incident management team of doctors and nurses that were in the facility by May 7th. But between February 29th and May 7th, we were going there daily, on a daily basis, and we're having death investigations. And then some of those, that was then turning into just the funeral homes coming to pick up people. They're now supported by skilled nursing. And so that would be one piece of advice that I would give to any other police chiefs. If you start to have one location in your city where you're seeing a number of these cases, you have to put some political pressure to get more support into the facilities sooner than later.
Is that what you mean by hot zones?
Yes, I would say this is the hot spot for our city, is one facility. There are other places in the city where we've had COVID positive patients, but this is definitely 35 deaths attributed to one facility.
Let me ask you about those hot zones, and you said there was a political element. Talk to me more about what did you mean? Tell me more about what that's all about.
Again, just from my perspective, the facility did not have enough support, and some of their caregivers were also sick. That we had both our mayor, our state representatives, and even congressional members that were making phone calls to the governor's office and in turn to the CDC to get support for that facility. And when they did finally get medical teams on the ground, the calls have dropped off dramatically.
Those, did you say, if the people who have died, did you say 35 people have died?
Yes.
Do you know approximately how many of those 35 are over the age of 60?
I know those demographics are available. In the first week we were getting more information on exactly the age. I believe there's one visitor that has died that's attributed to life care, and most of them are 70 and 80-year-old people that have been in the facility with other health conditions as well.
Because the thinking is that the reason it hit so hard is because most of the individuals were in their 70s or 80s, and so is there anything the police department should do, given that group seems at a higher risk? Are there things that cities should do to prioritize the handling of those individuals?
We certainly have notified, we've given our officers lists of all of the care facilities in the city, all of the adult family homes. We've put some officer safety alerts on, obviously, Life Care Center that when they're dispatched to a call at that address, they get an officer safety alert to use their protective gear. And then we've asked them to take care in, again, making phone calls inside, asking people to come outside. And so not only do we need to protect ourselves, but protect them as well. And so, yes, those are some of the steps that we've taken with the elderly.
Okay, Chief, stand by. Let's get Deputy Commissioner Rob Gazzola on from New Rochelle. Commissioner, can you hear me?
I can. How are you?
Oh, good, Bob. All right, let me just tell you a little bit about the commissioner, deputy commissioner. He's a 34-year veteran, New Rochelle Police Department, served as the commanding officer in 2002 to 2015. He's had a lot of different experiences over his time, and we're grateful for you being on with us. So the other big center in the country has been New York, and New Rochelle has been is the center of this. Can you go back and tell us exactly when you knew you had a problem in New Rochelle?
Sure. So March 2nd was the first reported case in the New York City area. March 3rd, the next day, was when we learned that the second person infected in our area was a New Rochelle resident. That individual, who became, I guess, the index patient for us, is a 50-year-old male who lives in New Rochelle, works as an attorney in Manhattan. So he travels from his home into Manhattan along Metro North, which is a local train station. We're about 35 minutes north of Manhattan. He attended services. He's at a local synagogue on February 22nd. It is believed that he was infected then, probably infected much of the congregation. It's a tight-knit congregation on the 22nd. In addition to the regular services on that Saturday, there was two large gatherings there on the 23rd, one a bar mitzvah and one a funeral. So there was, approximately 1,000 congregants that he may have contacted over the course of that weekend. What happened was he had fell ill and was taken to a hospital in a neighboring community by a neighbor. And he was at that hospital for several days. They weren't sure what happened. He didn't fit any of the criteria that at that time, the travel information, the contact with anyone. So I guess they weren't sure, and he ended up down in New York Presbyterian where they confirmed he had COVID-19. Subsequently, the Westchester County Health Department quarantined all of the congregants. They had them self-quarantine about 1,000 congregants. Eventually, this gentleman got critically ill. He's currently still in the hospital, but luckily his wife had reported the other day on social media that he is rebounding nicely and it looks like he's going to be okay. He infected his wife, 2 children who resided with him. The neighbor who had taken him to the hospital was infected. It got passed along to several other people, but he became kind of the index patient for New Rochelle. And what we're finding is that a lot of most of our cases, we had at that time over 100 cases. I think we're up to 185 cases today. Many of them could be attributed to that one area. So what happened?
You know,
Yep.
I'm sorry.
Nope.
Go ahead, keep going.
No, so I was just gonna say, so subsequently what happened was that the Westchester County Health Department and the State Health Department recognized a need to really come into the city and try and control that from spreading out throughout the rest of our city and into Manhattan. So they ended up sending up an EOC in New Rochelle with state and county health department, and they started doing some home tests of people who are believed to have been contacted. And you would call an 800 number, and if you fit the bill, then they would send a team out to do some testing. They learned quickly that they were going to have more tests that were needed, so they ended up having a drive-through. The governor actually declared a state of emergency at some point about March 7th, and they established eventually a drive-through sampling center here in New Rochelle, March 12th. It was the first one on the East Coast at the time.
You know, Commissioner, the thing that is so frightening about what you said is that one individual could, unintentionally cause so much, spread the virus so much. When you look back at that, why was that the case? I mean, how is it that possible that this one individual, I know you said, he was at a synagogue and then he went to different ceremonies, then he goes into New York City, right, where he works. That one person created, is that a fair characterization, or were there other factors?
Yeah, so that's the information we have, that he became, he was the index patient. He didn't have any of the, at the time, the big question out there was, did you travel abroad? Had you taken a flight somewhere? Were you in contact with someone who may have traveled? And he hadn't had that. And so we're not really sure. I haven't heard anyway where they believe he contracted it from. But the way they did their investigation, it all stemmed back to this one individual who had, again, multiple contacts with hundreds of people in a short amount of time in one location.
One thing that's been in the news is that the governor ordered a containment zone. Can you tell people what that's all about?
Yes. So unbeknownst to us here in New Rochelle, the governor declared, after declaring a state of emergency, he had declared a containment area, a containment zone in New Rochelle. And soon after mentioned that the National Guard were going to come into New Rochelle to help. Unfortunately, the messages got commingled, so it sounded as if there was going to be like one of these militarized no-fly zone. People are going to be trapped in, can't leave, can't travel out with the military standing guard. What the containment zone meant, and what we've been trying to express to people, and the governor has now since explained it much clearer, that the idea was to have a 1 mile radius set up around the synagogue, which incorporated all larger structures, so churches, synagogues, any school that fell within the 1 mile radius would have to close in order to eliminate the larger clusters of people gathering together. And you know, it wasn't a military zone. It wasn't that people couldn't come and go. If you were there, you wouldn't even know that you were in a containment zone. It was really, the idea was to contain the disease, not to contain the people. And the military, the National Guard came in, but they were here just to help distribute food to the people who were essentially shut in at the time, and to you know, help give out food to the kids who get the lunch meals, who weren't going to be able to because the schools were being closed.
Let me ask you something that I asked Chief Harris. Again, you know, you've got a lot of people across the country who are listening in. What advice, Commissioner, would you give departments? How should they think about this to prepare? What lessons have you learned about what, you know, smaller agencies need to do? It feels like this can be overwhelming very quickly. What should departments be doing that you've learned from?
Right. So it is, and we're still, you know, very much involved in this, and it changes day to day. A lot of the information we're getting from the healthcare professionals changes every day. How do you deal with your personnel changes every day. So we're trying to balance keeping our guys safe while also providing police services to the community. But I think if you learn anything from this, or if you take anything from this, it would be that when you have the opportunity to stockpile some of the items that you'll need in these kind of instances, you should do so ahead of time. We were, I guess, fortunate enough, we had a fair amount of PPEs. We ended up making a purchase as soon as this felt like it was going to be a big thing here. We were able to get some stuff from our county Department of Health, but it's never enough. And it's something that you want to consider, and not just PPEs, but also the hand sanitizers, the wipes. You know, you have police cars that need to be sanitized and cleaned, and you realize, you know, they're used every day. 3 different people jump into a police car and they have to be cleaned, and it shouldn't be borne on the backs of the cops. We should have this stuff in place. So those are kind of things that you probably should take from here. You know, understand that we need to maybe do a better job of having that stuff available ahead of time. It's almost impossible to get it now.
Have you changed any of your operating principles? For example, have you made any policy changes about arrests? Are you changing in terms of triaging calls? Have you done any of that?
Yes.
Those changes?
Absolutely. So we are community-oriented based policing. So, you know, we like our guys to have a lot of contact with our community. One of the first things we did was tell them, you know, no more of that. The unnecessary contact, we have to put that to an end. We started looking at our calls for service, things that we could do over the phone. We started, and we always had some phone reporting, but we increased the number of details that we would take over the phone, just again to avoid unnecessary contact. We've kind of relaxed non-serious violation enforcement. So again, it's all that extra contact with people that you don't maybe necessarily need. Our headquarters is closed to the public. Records is closed. Our city hall is closed. You could do certain things over the phone, but at this point, again, we don't want people coming into a building unnecessarily. If we could handle things by phone or online, we've been doing that. You know, a lot of it is just, you know, common sense. You just change the way you think about how you provide the service, at least for the short term, and those are the things you have to adjust to.
Did you say that you have the capacity to do drive-through testing in New Rochelle? Is that correct?
Yes. So New York State has set up, the state health department has set up a drive-through testing center, sampling center. It's in one of the parks in New Rochelle. It's a large park close to the Bronx border. Have the state police, and luckily it's county property, so the county police are there. It doesn't really take from our resources. And the way it's set up, there's you drive in, you call an 800 number, you get a reservation, you go there, and you have to answer the questions. Obviously, you have to be symptomatic, et cetera, and they have to give you the reservation. You go there, they let you through. You go into one of, I think they're set up with 3 lanes now. And I believe there's 3 different stations. You go through one station, they check your paperwork. Second station, they do the swabbing. all while you're in the car. And the third section, they kind of close you up and tell you, you know, you'll get the information in 2 to 3 days.
Bob, let me ask you this. In terms of testing, you seem to be, you know, the leader, one of the leaders in the country in this testing. Was that hard to get? And then who gets to be tested? Is there some criteria to be testing? Are you testing all of your first responders? How does that work?
Right. So luckily, you know, we have good relationship with the Westchester County Department of Health, who is, you know, our, I guess, localized medical assistance. The state had come in very early, so you have those two agencies that are running the testing, running the sampling. For us, we have had people tested. Early on, it was, you know, you had the casual contact. We weren't given a lot of guidance as to, you know, who should in fact be tested. But when we had people who we believed had contact, we were able to facilitate getting our people tested. But typically when for you know, a citizen who wants to be tested, you know, they could either get a kind of like a prescription from their doctor who would agree that they have to be tested, then they can go to one of the sites, or they call an 800 number. It's connected to either the state or to the, I think it's the State Department of Health, and they're given a registration number and they're able to then get tested that way. The testing is.
And how long does it take to get the results?
Yeah, so my understanding is that a positive result the turnaround is relatively quick, 2 to 3 days. We've had an instance where, you know, one of our members was sick, was symptomatic, got tested. We waited over a week for him to get a negative test. So I don't know if that's common, if the negative tests are taking a little longer for them to get back, or it just happened to be in that case. But the turnaround by the state should be roughly, you know, 2 to 3 to 4 days. Again, they're
I'm sorry.
So again, you got to remember, there's a sampling center, which is the swab, then the actual test, and the testing has to be done in a laboratory. And initially, they were going up to Wadsworth in Albany. So, and they were the only testing center. I think the governor has since allowed private labs to open to facilitate the testing, because that's where the holdup was. It's not the swabbing. The swabbing takes, you know, a matter of you know, a couple of minutes. It's actually getting the samples tested, which took some time.
Quick question here, and then we'll try to get some big picture questions. Has this drive-through testing, has it created any traffic or civil disturbance issues?
So luckily, no. We've had, you know, some minor traffic issues a couple of nights. They're able to accommodate. They accommodated over 800 vehicles yesterday. Seemingly each day they're getting a little bit more. You know, they were hoping to be able to test, you know, 400 to 500. The information I received yesterday was they were able to test about 800 cars. So I think the capacity is there. You know, now it's, you know, we're a week into it, I guess, a little over a week, and they seem to be doing well.
Do you feel like you're past the danger zone, or do you feel like the worst is yet to come?
So no, I don't think we're past it by any stretch. I think what's probably going to happen is that we're going to see police officers starting to be tested positive just because of the number of contacts. And you know, now we're, you know, we in your show we're you know, I guess almost 3 weeks into this, and you know, initially it was, you know, we all kind of shrugged our shoulders. Okay, it's you know, like the flu. And you know, the more we're involved, the more we see it's you know, this is a very serious global issue that we're dealing with, and it does not seem to be going away. It doesn't seem it will be going away anytime soon. So we're
okay
for the long run.
Okay, and is Chief Harris, are you still there?
I am.
Okay, let me do this. I don't know if we have this capability. If we can, I apologize. If you were to ask either of you, the law enforcement people, the CDC a question, the public health officials a question, what would it be? What would you want to know? Now, do we have the capability? Are they still on?
Yeah.
Okay, so let me ask the law enforcement people. what question do you have to our public health partners that you might want to ask them?
So for me, I think they may have answered it already, but I guess just to get some kind of, if they're able to provide a written confirmation as to what they recommend for contact with a first responder, how we should respond. It's whether, because we're going by, a different set of rules seemingly every day. I think what the CDC personnel explained today seems to be what our Westchester County Health is saying, regarding, if you get a contact, you work until you're symptomatic, and then you decide how to handle it. I guess if we could get, real clarity on that would be what I need answered or like to answer.
Do our public health people want to respond?
Yeah, so this is Marie DePirio. We can provide that link. There's both guidance for risk assessment and management of people that have been exposed or have had contact with cases, but then there's also guidance for return to work or discontinuation of home isolation if someone is actually sick. So we can post those links. Those are being updated frequently as we know more information.
Chief Harris, any question you would like to ask?
No, I have that. That's the same significant issue that we're facing here. That if someone knows that they have been in contact with someone, maybe even on their days off, but they're not sure, if they had been, if it's a family member who's positive, have they exposed anyone at work? Do we have to put an entire squad of police officers in quarantine because one person has been exposed and they're not symptomatic?
Yeah, this is Marie DePirio from CDC. We generally don't recommend any special restrictions for contacts of contacts. So if a law enforcement officer was exposed at home, goes to work, as long as they're asymptomatic, and the officers that this person works with have not had contact with that family member, then there should not be any work restrictions.
Let me ask a question. I'm sorry. Let me ask a question to the CDC folks. If you get the virus, you recover, is it safe to assume you are now immune? Can you go back to work?
Yeah, so we're still trying to figure out after someone has recovered from the virus, if they then develop then they develop immunity so they don't get reinfected. We're still trying to work that out. We do know that if you have recovered from the virus and you are asymptomatic, people can go back to work. And that's that guidance that I was referring to after, 3 days after resolution of symptoms and your fever, or 7 days after illness onset, whichever is longer.
But after you recover and you're okay, you're not contagious anymore, right?
You should not be.
Okay. Does anyone on the panel have any closing comments they want to make? We got about a minute, then we're going to let everybody go. Any closing comments that anyone wants to make?
No, I'm good.
Okay. I want to thank the Police Foundation, Jim Birch and his crew, our major city chiefs, and all of our listeners. Thank you very much for what you're doing, and we appreciate it. Thank you.
And Chuck, in closing, we are going to make the recording of this webinar available online. The 3 different organizations will work to get that out to their membership, and we also hope to make the slides available separately. And we see we've got over 200 questions pending. We're going to do our best to try to take a look at those as well, see if we can get some follow-up answers. Thank you, Chuck. Great job. Thanks, everybody. Thanks to all of our panelists. Have a great day. Stay safe. Stay well.